Consider the possibility that he may have coerced or influenced the decisions of the patients, and in some way causing them to want to end their lives, taking advantage of their hardships or inability to think clearly. Also, some people came to Dr. Kevorkian when their diseases had not taken full effect, telling him they wanted his services, so he may have taken advantage of them in their desperate state of need. In other words, he preyed upon the weak.
He claims that he had tested the mental states and lucidity of each of his patients before he gave them a means to an end, so to speak. Also, that he never jumped at an opportunity to give a patient his services. He always gave them at least 1 month to make a concrete decision, in which case he would not have been taking advantage of such rights and responsibilities in question.
Kevorkian gave each patient in this state of mind ample time to come up with a decision, and tested each of them to ensure their lucidity. Apart from these methods, there are no objective ways that we could go about helping them make such a decision, at least not ethically, as the only concrete method possible would involve influencing such a person's decision, and that type of interference can be selfish and unethical. Aside from that point, that is also widely subjective and varies upon each person.
They are to go under treatment once the illness takes effect, and if the decision is still desired, then they may be taken off of life support or given a lethal dose of some sort of medication.
In such a case, these extenuating circumstances lead the individual incapable of thinking properly. The individual's will should be consulted, but if said will does not mention their stance on this particular issue, then the individual's closest family members should be put into question.
It's tough to come to any objective conclusion on this particular topic due in part to its controversial nature. Nonetheless, in order to take a clear look on its ethicality and morality, we must take a transcendental look at it, removing ourselves from the typical opinions and ideals of our society and culture. To be blunt, it's very selfish and conceited of us to believe that we have the understanding, comprehension, and knowledge to make any such decision on another person's life. That person is also a human being, and they have their own beliefs, ideals, and personality. They are their own person. For any of us to make some sort of executive decision on another person's life, especially in this context, as it is a truly large decision to be made, is out of our own hands, and is in such another person's hands. This, of course, speaking in which case that the person is lucid, able to think clearly, and containing the audacity to make such a decision.
Thusly, we implore each of you to do your own research on this topic and decide whether or not you believe that this is ethically justified for us to make these types of decisions or not. We also encourage you to develop your own way of thinking, and do not allow others to shape your own perspectives simply out of peer pressure or others' opinions. Although standing up for your own opinion is not always an easy task. Kevorkian was incarcerated multiple times, as well as having been declared insane.